Welcome to the LowCarbMD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome to the LowCarbMD podcast. Today, Tro, we got a Pharm D here. We got to spend some time at Low Carb San Diego, but Tro wasn't there, so we got to talk about him and have fun. A Pharm D who knows about low carb keto, and she's doing some great stuff. And this is new to me as an MD, saying, "Hey, can we team up?" Because there's so many. I'll tell you. Well, first of all, Jody, welcome, Jodi Nishida.
Hi, thank you.
The Keto Prescription. Right, you still, well, gosh, you got it before we did, but welcome. It's so good to have you. And so tell people about your journey, and unless Tro, you have anything you want to say, man. I haven't talked to you in a little while. How's life, man?
No. I'm just excited about this. It's great to get kind of somebody with a doctorate, a Pharm D in pharmacology, and how she approaches deprescribing and how she's dealt with her own autoimmune conditions. And on top of that, we know she's gotten further education. So I want to hear about how she's gonna, Hawaiians are suffering. We know you guys have a big rate of diabetes there, surprisingly, at a normal weight, higher incidence of diabetes at a lower BMI. So a lot of things going on over there. I'd love to hear about kind of, how you got started and what you're doing.
Totally. It's a good story. Because it's a bad story with a very happy ending. But my dad, who actually, he and I had been estranged for like 13 years. He had a heart attack and his LAD was 99% occluded. So he had the widowmaker. We reconnected in the hospital, after all of that happened. And one of my colleagues, who's a pediatric neurologist, when I was talking to him about this, he goes, "Oh, you should put your dad on keto." This was 4 years ago. And I looked at him, I said, what the heck's a keto? And he's like, "Well, I know how you are." He goes, "Just research it." I was like, okay. So it's funny because the first book I bought was Keto Clarity by Jimmy Moore. And what I liked about it was it's written in layman's terms, right? So it was so easy to read. And I read that and I was like, holy crap, we are totally practicing medicine backwards. So I kind of figured out on my own, how to do keto and put my dad and myself on it. And what happened was in 6 months, and I was doing it totally wrong back then too. In 6 months, my own autoimmune condition. So I had severe psoriatic arthritis. It was like head to toe, not the psoriasis part so much, but the joints. It was every joint in my body. It went into remission, and I had been on injectable biologics. I was injecting myself weekly for 13 years. I did that. And I was finally able to come off of my meds. I started talking about it on Facebook videos. I would do live videos on Facebook. And all these people started asking questions and they were obviously very interested. And that was how I started getting the thought that, I think we need like a keto clinic here in Hawaii. Tro, to your point, over 50% of the people here either have prediabetes or diabetes. And so I actually sat down with the VP of our Blue Cross Blue Shield plan here in Hawaii. And I said, hey, I have a problem. I'm a Pharm D and we don't typically have our own private practice. This is what I want to do. How would I legally go about setting that up? So we looked into everything and she said, well, you can totally do this. And by the way, I'm a big fan of low carb keto. You just have to build incident to an MD. She's like, so you got to get an MD to come on board with you.
Oh, so, yeah. Let me tell you, I know a lot about incident to. There's a lot of regulation behind that. So that's kind of, people don't understand. To be able to help people, there's a lot of regulation. Like even having a lab machine in my office, I have to get a CLIA waiver. Like we have to go through, even though these are, equipment that is kind of standardized, there's all these regulations and how you can bill right? And what you can send to the insurance is so highly regulated, but it sounds like you had the right people there to kind of lead you the right way. So what happens next?
Yeah. So I through a friend who was a drug rep, I got introduced to a physician, and I should have known, you guys, because from the first meeting, this individual was literally foaming at the mouth with everything that I wanted to do. You know, I was already doing cash patients, but I wanted to be able to bill insurance so that I could see the Medicaid patients and the Medicare patients as well. So we joined forces, and everything was great in the beginning. And then we moved into a bigger office, started kind of growing things, and then COVID hit. And so for about 3 months, do you remember, doctors couldn't, in certain specialties, couldn't do elective procedures. And so I think what happened was this individual's annual income went from 2 million to 1.75, and he totally freaked out about it. And everything was going great. Like, he was saying how low carb and keto was literally reversing everything he treated for his entire 35-year career just with food. But then COVID hit, that happened, and he decided that he needed my reimbursements. And so he basically stole all of it. And when I got upset about it, then he refused to submit about 250 of my charts to the insurance company. So I lost out on a lot of money. And that was a really rough experience for me, because I basically went out of business for a little bit.
Brian, we should change our careers, man.
I know, I should be a GI doctor, I guess.
Yeah. You know, I'm still paying off student loans. This guy's making $2 million a year.
Yeah, it's like, wow, I might go. Yeah.
And hassling you over a couple of claims. Like, this sounds like a terrible environment. It sounds like a really terrible environment. Yeah, there's a lot of hustlers in medicine. People don't understand. It's not like, most doctors mean well, right? But it's hard. It's hard to do the right thing, right? It's hard for these people. And when there's money involved, and when it's your own livelihood and income, people start to act really strange. And if you look,
yeah, and they look at the short term and not the long term, and saying, hey, look, we could team and we could really make a name and we could really help a lot of people. And just from a doctor standpoint, even if you don't make a dime, if all your patients are healthier and doing better and doing well, that there's money in that. I mean, money as far as not financial money, but I mean, that is like gold, to know you're actually making a difference in helping people and partnering with someone who knows how to do that.
And
but
people value that.
I've learned that we are few and far between. Like, we are a very different breed, apparently, right? And that's the thing. It's just like, well, Hawaii is very expensive. It's so expensive to live here to begin with. So I don't know if that drives behavior. But I hear stories of MDs stealing from each other, and this happens with PAs and nurse practitioners as well. It's going on all over the US, apparently.
So just so you guys know what incident to billing is. So Medicare and insurance companies, okay, what they say is, you don't have to be a doctor if you to bill as a doctor to an insurance company. You have to be either I guess it's a Pharm D, a NP, a PA, or a physical therapist. I think these are the four.
Chiropractor too, I think.
Yeah, possibly. So now, if the physician creates the treatment plan and is under the same roof, right?
Yes.
Those physician extenders can bill as if they're the physician, right? So it can be really, really good if somebody like me or Brian has trains NPs, doctors, or PharmDs, you know, or to kind of work together to deliver a vision on healthcare, and we create that initial plan, and then we, you know, pass that plan off to be monitored by somebody else, right? So incident to billing, but it's come under a lot of scrutiny. A lot of orthopedics, GI docs have abused this. PM&R, physical rehab doctors have abused this. There's a lot of guidelines on what can and can't be done, right? Because docs have abused this. And clearly, it sounds like you were with a doc who abused that and maybe was more financially driven than anything else. So how do you escape all that? What happens next?
Yeah, I mean, I had to go to the police and see if I could file a criminal report for theft. It's obviously a white collar crime. But they said because it wasn't over $100,000 at the time, they couldn't take it on. So I would have to pursue a civil suit. So we parted ways, basically, long story short. And the awesome thing is the same cardiologist who operated on my dad when he had his heart attack, I've known her for many, many, many years. And I called her, I picked up the phone, I called her and I told her what was going on. And she said, come over here. She said, come over here. She's like, you know what? I've actually been meaning to talk to you for months. Come here, let's sit down, let's figure this out. So we met and she saved me. She saved my clinic, she saved my butt. I've been in her office for the last 4 or 5 months now. And, they say how things happen for a reason, right? I clearly was not meant to be with that other doctor. And all of that happened so I could land in her office because it is such a good environment. I mean, it's good because we do all the cardiac testing in our office. So we'll do it at baseline on all of our patients. And then we're going to be doing it annually moving forward. So she does the initial appointment required by insurance. She basically clears them for keto and then I take over from there. And it's just been, and I think it's making other doctors in our town feel a lot more comfortable about keto because they're all worried, keto's going to give my patient a heart attack. Oh, but if Jody's with the cardiologist, maybe it's okay, right? And so it's been phenomenal. And I'm one of those weirdos, like my LDL is always at 190 on an average day. And we've done 2 rounds of the triple vascular scan on me over 3 years. And I'm like, good, I'm clean. Plumbing's good.
Yeah. So guys, just so you understand what that means. So her LDL is at a level that the current ACCHA guidelines would consider somebody to be FH, right? Which is familial hypercholesterolemia, which would be an indication for statins. But we know that in medicine, right, and particularly low carb diets, that people who are lean or have lost weight and had fairly low triglycerides to start with or at a high HDL to start with, they typically will see a higher LDL increase with weight loss from a low carb diet, right? They'll see a higher LDL increase. Now, the question is, and there's a lot of people like Dave Feldman who are working to see if that is the same pathology as FH. And what Jody is describing here is she's done some intensive kind of vascular testing and she has not seen that pathology you'd expect with FH. Did I get it right?
Yes.
Yeah, I got it right. Yeah.
Yeah. So what people don't realize is people react to a number very quickly and not say, okay, let's look at your insulin level. Let's look at your 3-month sugar average. Let's look at your triglycerides, HDL.
Yes.
And step back and say, let's do some testing. And, I think there's a lot of questions out there still, but I think a lot of those questions are going to be answered.
Mm-hmm.
So
because there's some great research going on.
Yeah. So how long have you been practicing now at your new clinic?
Well, in total, I've had Keto Clinic open for 2.5 years. I've been at the new office of cardiology for just over 4 months. Everything's going great. It's interesting. 2 of my biggest referring groups are orthopedic surgeons and rheumatology. So they send a lot of patients to us. It's nice because we've just built this model where, she does all the medicine part, and I do all the low carb education part. And, it's complex. I've talked to Brian about this a couple times because my appointments are 30 minutes long each. And I'm able to make a great living on that, billing insurance. I spend a lot of time getting to know the patient. We figure out what all their stressors are. There's so much that goes into this, talking about food addictions, eating behaviors. I calculate insulin resistance on everyone, and we follow that score over time. You know, just we've got all the cardiac testing in the office, and we have fun. What I tell people is we laugh, we cry, we get real. Because my saying, and some people get offended by this, and I don't get it, but my saying is getting healthy shouldn't suck. You know, before I didn't want to get healthy because I was like, what? I got to eat salad all day and work out constantly. That sucks to me, you know? And with keto, it's so enjoyable. It's such a life-changing, enjoyable lifestyle, in my opinion.
Yeah, and I think it's one size fits one. What works for you? What is going to work? What do we have to, let's twist it a little bit. Do you have to be, you know, I have couples I take care of. One's really insulin sensitive. The other one's insulin resistant. So the insulin resistant was like, how come he can eat carbs and I can't? Well, I'm like, well, look at your insulin, your 3-month sugar average, all these things. He's a different, right? Or she's a different than you. So it's one of those things where you realize, okay, it's not one size fits one. And what works for you, what's tolerable. If you need to have cookies once a month and that's going to make you happy, like let's work with you and see what's tolerable. If I say you can never drink again, you can never have pizza again, you can never have, like, people go, okay, I'm going to do something else. I'll try something else. That's not good. So I think, but a lot of people on their own just go, yeah, I don't get the enjoyment I used to get out of certain foods, and gets easier and easier because I'm not hungry all the time. And that, hearing people say, yesterday I had 2 people say, it's so weird, doc, I'm just not hungry all the time anymore. And I feel great. And I don't feel hostage anymore. And that's so good to hear, because that's a huge deal, right?
Yes, because the carb addiction is literally like the food handcuffs. It's so true. Yeah.
You know, the other thing I wanted to jump in on really quick, and then I'll let Tro take over. It's really important what you're talking about with rheumatologists and orthopedic surgeons. I've seen that marriage for a long time. I'm surprised more orthopedic surgeons haven't reached out and say, hey, what are you guys doing over there? Because a lot of people, they can't clear for surgery. And if they can, they're a huge surgical risk. So if you give it to someone like you or what Tro and I are doing, we minimize the surgical risk to the surgeon, to the patient, to their families and all that. And rehab is going to be a lot better if you're 40 pounds lighter or 50 pounds lighter when you go for, and it's such a intervention that we could do, especially because you have a motivated patient, someone like your father who has a heart attack. Now they're motivated, or someone who just got diagnosed with diabetes. Guess what? They're super motivated. Someone who's been living with diabetes for 10 or 15 years and they go, I don't care, shooting this stuff's not a big deal. They're not going to be as motivated. So I think that's a really, doctors listening, if you're an orthopedic surgeon, rheumatologist, reach out to someone who's doing low carb in your area, because you can team up and do great things for patients for sure.
Oh yeah.
Well, you say you're here. We got them everywhere, man. We got them everywhere. In your area, we got them everywhere.
Keto people? Yeah, there's docs everywhere now, right? Yeah, they get it. But not everywhere. I mean, there's a lot of people, it's sad, right? You know, you're getting licensed all over the country. And, you start realizing, there's a lot of places where it's an island where they don't have anyone at all. And they'll drive, they'll fly. And it's sad. People should not have to do that. Especially when we have pharmacists who get it and people who can help you.
Yeah. And the good news is, so 2 of the schools of pharmacy in the US have reached out to me to have their students start rotating through my clinic, because, one of the things that I'm very interested in is helping to evolve the practice of pharmacy. Like, I did work in retail pharmacy for a bit, you guys, counting pills by 5s, and I wanted to kill myself. Like, it was the absolute worst. I'd go home every day and be like, oh my God, I can't believe this is what I'm going to be doing for the rest of my life, and yet we're so educated and trained and qualified to do so much more. But there haven't been many opportunities, like outside of the VA. The VA's got great clinics. But that's why this whole keto thing, and we are perfect in terms of titrating meds up and down, teaching patients how to check their blood sugars at the right times, like all signs and symptoms of orthostatic hypotension, all of these things that we come across in our daily routine.
And drug interactions and tapering medications. Yeah, all that.
Pharmacists are perfect for that. So I'm hoping to open the floodgate so that more pharmacists enter this space, and that maybe someday can end up partnering with physicians such as you guys to take some of the work off of your plate.
does that look like? So I'm ready. I'm sold, Jody. Tell me what happened.
Yeah. And I think, the other thing is, I'm telling you, we talk about physician burnout. Like you're saying, pharmacist burnout is massive. I had to go get some meds before my trip to Guatemala, and I was at the farm, and I saw how people treat the pharmacists. I was like, oh my gosh, man, they're just brutal, like yelling at them.
No,
And it's just, there's no respect. It's just really
there's none.
it's a hard thing. It's hard. And then, in the system, like they're expected to work tons. I take care of several pharmacists, and I'm telling you, it's so hard. I see them burned out. They got to have time to work out. I'm tired. I'm exhausted. I'm on my feet. And it's just it's such a, it's a mill, like a lot of doctors in the system, that it's a mill, and you're just always burned out and always stressed out. And they, seriously, when we were at Low Carb San Diego, because of you, I talked to several pharmacists, and they just are hating life. They're like, I cannot, if I could do something else, I would quit my job and do it in a second. Right. So having that opportunity for pharmacists to team up with docs instead of, trying to figure out our handwriting, you don't have to, that struggle got a little bit better with electronic records and prescribing. But, I know, people would come up to me and go, hey, your partner wrote this. What is this? I'm like, I have no idea. I can't read that. And that's part of the safety for patients too. It's like, doctors are in a hurry and they're just scribbling stuff, and you get crazy orders, and I've had pharmacists save my butt a couple of times. Go, did you mean to order this dose? I was like, oh my gosh, my nurse sent it in that they hit the wrong button or something, right? So we have to figure out how we work as a team and really cover each other and help each other. And I've seen times where the doctors are yelling at the pharmacist, but the pharmacist is saving their butt right now because there's an interaction they need to know about.
Yeah, no, so troll, well, what does that look like, right? I get asked, I've been asked to franchise my clinic nationally, but once you get across state lines and different laws, what's interesting is there is like 11 or 13 states where pharmacists are recognized as healthcare providers and can actually bill insurance directly, just not here in Hawaii yet. And so, opportunities do exist. I think it's like step one is continue to get the word out there about keto and low carb and the benefits of it, and have people do it themselves like I did. Step two is once they realize the benefits of it and they get excited about it, then hopefully more and more of them will be like, hey, how can I start to do this for a living? But that's why I want to figure out how to get more pharmacists to the conferences, that we attend so they can learn more. And then I know, Brian, you and I have been talking about how do we work with Doug to build some kind of clinical track at the conference, to help people figure out, because talking about it is one thing. Come on, you guys know this. Actually going into private practice and the whole business aspect of it, that's going to eliminate 75% of people. You've got to be pretty tough to do it.
Yeah, I think we have to make it easy for people. So, like we have, like right now to run my business, we have 20 cloud-based softwares, 20, right? We have an app that we're coming out with this month. Right, we have you see the green screen behind me. We have education videos that we're going to make, and we're going to continue to make. Nice. We have remote equipment. We send out-of-network bills for insurance. We collect payments. We have legal. I have expensive healthcare lawyers to make sure everything that I do is proper. And the reality is we can't expect everybody, like Brian took a huge risk to do this, right? I took a huge risk to do this, right? I don't think many other people will go through what we've been through.
No.
Would you agree?
I would agree.
I can't, most people like the idea of private practice, but they just want a paycheck and hours.
Yes.
And that's what makes it tough. And even if you can agree on a vision, so you're grounded in medicine, Jody. Brian was a chief resident. He's grounded in medicine, right? So a lot of times when we get people who understand nutrition, right, and understand the power of nutrition, they want to escape medicine. And I don't know that we can escape medicine. We just have to work within, we have to kind of marry the two in a way that works for the person in front of us.
Absolutely.
And most of the time I found, and Brian, if you agree, like if somebody's pro low carb, you don't know how far down the rabbit hole they are. Most of the time, sometimes you have these vehemently independent doctors who are way far down the rabbit hole. And it's like, okay, how do we find the right people to work together to deliver amazing care? And then if you go to the traditional realm of doctors and pharmacists, like convincing them the power of nutrition is almost an insurmountable task. You know, so I'm left with this, like, how do we find somebody who's, you know, down the rabbit hole and ground them in medicine, or do we find somebody grounded in medicine and bring them down the rabbit hole? So what do you guys think about that, Brian? And Brian, I want to hear you because you've, and then Jody, maybe we could hear from you too.
I say you need a critical thinker. I think you need someone who can look, I don't care where you're from. I don't care if you're a chiropractor, physical therapy. When you have a critical thinker and someone said, here's the problem. What I'm doing is not working. We have to reassess. I've had chiropractors save someone's life because they say you're not responding the way you should. You need a brain MRI that the doctor was not getting, and they have a brain tumor, right? So there's people who know what they know, and they know their area, and they say, something's not right. So when we're treating diabetes with drugs and they're getting worse and worse, and they're getting complications and going blind and having dialysis, like we all know, Turo, then you say, okay, I have to reassess what I'm doing. And I think when you personally go through it, I think people like Jody was saying, when you get a pharmacist who says, oh, I lost 30 pounds doing keto and I feel better and my numbers are getting better, my diabetes reversed, then they're more passionate to help other people. So I think it's a passionate person, and I think you have to be long-sighted, because if you say, hey, I'm going to make, all this money, like your first doctor you worked with right away, it takes time to build a practice. It takes time to get a partnership, and you have to be patient, and you have to be willing to do that. Problem is, a lot of us have huge med school loans and pharmacy school loans, and it's a stress of saying, oh, I've got to provide for my family, and it's too stressful. I'll just take the paycheck. And that's what's happening with the good young doctors a lot of times, and pharmacists.
And I'm going to add to that. You said critical thinkers. I think the person innately has to be a little bit of a disruptor. You've got to have a little bit of that disruptor.
Tro has a lot of that. He has a lot of that. I
have a lot of that too. I stood out like a sore thumb in pharmacy school, but it
like, why are we telling people with diabetes to eat sugar and pee it out? Like, or why are we just stuffing it away with insulin, right? Like basic, simple concepts, like, is there another way to decrease interleukin-6 other than a monoclonal antibody? Like, is there another way, right? Is there like another way we can reduce interleukin-6 and TNF-alpha? I'm just wondering, I'm with you, I'm with you.
I think, what I love about you guys, because Brian, the first time I met and heard Tro was at Grand Rounds at the beginning of this month. And I was like, oh my God, I love this guy. Oh, it's the same guy, that yes, this is perfect. But your approach, and then personality, not only critical thinker, it's not only disruptor, it's like your personality, because these patients that end up coming to us, they have been to the mill and back. Typically, right? They have fired a number of physicians along the way, and you have to be so relatable, so real, so empathetic. You've got to be a good listener. There's so many. So how do you, and it's funny because I am having to figure out my scale up plan for my clinic, because Jody, I'm almost at full capacity, right? So now I've got to go out and find other pharmacist mini-me's, basically, that can help, because we're on Oahu right now, but we're building another location on Maui. But how do I do that? Right? They don't have to be exactly Jody, but how do you find someone with all of these different elements?
If you find out, can you let me know? Because
yeah, and I think that's
maybe.
No, I actually am writing. I'm a weird nerd. Like, I like writing business plans and stuff. Like, I'm actually writing a whole, what does this individual need to look like and have, and if not, how do you train them for these skills? I'm a big believer in my keto stepwise plan, and I can do everything from vegan keto to carnivore, so the whole spectrum, right? but it's like putting this on paper as a curriculum. You know, I bet if the three of us sat down and compared notes, our programs would look pretty darn similar, but it's just packaging it into a, I don't know, a what, a franchise, a course. It's like, what do we do? You know?
Yeah, and I think if you can have all the knowledge you want, but if you can't connect with that patient, and I've noticed that I've seen a lot of practitioners, they just don't connect and say, hey, look, I'm in your corner. Let's do this. Okay, you screwed it up. Let's figure it out. No biggie. But people need that. So many people come to me and they're waiting for me to get mad at them. They go, oh, I had cookies over the weekend. I'm like, okay. So you had cookies over, you can't change that. What are you going to do? So I think a lot of that, but there's a lot of people go, oh, you had cookies over the weekend. Here, you need a drug to take your appetite away. Right. And then you don't realize this could be emotional. You're going through a divorce. Let's step back. Maybe this isn't the season for you, you know, and I'm telling you, there's so much of that. And I love that part of it, but it's very labor intensive. So you have to have people who can reach the patients, understand the physiology of what's going on, because, you know, I think as we're doing this, we get more experience and we change what we're doing a little bit. We have to be flexible and say, oh, okay, some people do better on higher fat, some people do better on higher protein, some people do better, you know, whatever. So I think it's one of those things, and some people need you to be a little tougher with them, and other people say, no, just hold my hand and help me and support me, right? So that's a huge part of it that people don't realize. It's not just saying calories in, calories out, exercise more, eat less. That's the advice all these poor people have been given, and they get sicker and sicker, and so they're frustrated.
Well, then let me ask you guys a question, right? Because we are having to be all of these things for our patients. You know, don't you have days where you're just really kind of emotionally exhausted? Do you know what I'm saying? Because you've become this person's new lifeline, basically. And I'm not saying it's bad. What I'm saying is the longer I'm in this, the more I'm realizing like it has to be a team-based approach. It has to be. Because otherwise and you guys are farther into this than I am, we're all going to start burning out too. You know what I mean?
Yeah, I mean, one of the big things that like every single person in my office has that empathy. We constantly get compliments about our front desk. We are there for them. We allow text messaging. We tell people to make it easy. I have two health coaches, Brian Wiley, who's lived this life for 15 years, right? And knows what it's like to be 100 pounds heavier. Amy Igus, who's lost over 200 pounds, knows what it's like to fail every diet, right? So I'm with you that this has to be a team. It can't just be one person. And, you know, you may say something that somebody doesn't jive with that day. So being able to have a second opinion and a second set of eyes, and we literally sit down and we pour through, we risk stratify our entire practice. Okay, we pour through all the remote data, like who needs help, who's reaching out for help, who needs help, right? Like, you know, looking at their remote data, who can we target, right? Yeah. And so we're as a team kind of figuring out how are we going to keep getting better and keep getting our you know, like the people who are struggling the most some help, and how to push people who are medium to go with the higher people, and how to keep the people who are performing really well staying very well. And I mean, it's come to the point where we're making our own app. Like, I'm making my own app. I never thought I would be doing this, so we can foster those social connections, right? To like, you know, like you and there's a saying in Armenian, it's called, you know, but there's sayings in every language, but the idea is you lift, first you get to higher ground, then you lift people to higher ground, right? And so that's a challenge. Every other model has done this. All the airlines share with each other their safety data, so they improve the entire industry. All the, you know, AA, right? They create social networks so people who are struggling have somewhere to reach out to. Right? Except in medicine, we haven't done that. We have no accountability system. We've allowed errors for years and years, and there's no system to work together and improve and innovate. So, Jody, when are you joining my practice? When are we doing?
I know. What?
California is so much closer, and the weather's kind of like what you're used to. So
listen, but New York
or
is
maybe Arizona.
New York has Statue of Liberty. We have mandates. You know, we have better mandates than California. stricter
you know
and
what?
harsher?
You know what, you guys? I'm not moving. But Hawaii's too cool, man. The weather, the surfing,
Yeah,
it's great
it's
out
awesome.
here. I
We have
do
Pizza Rat.
really.
We have
I
Pizza
do.
Rat.
Oh my God.
Pizza Rat.
I think the three of us really need to talk like offline and brainstorm something. I'm serious because troll, right? If you build it, they will come. I think there is a massive pool of pharmacists out there that have no idea what their next step is, but at the same time, they do not want to take the business risk. You know,
Yeah,
I mean, let me speak frankly. To do what we do, you gotta have hair on your chest and you gotta have pretty big balls. Like, I'm not gonna lie, right? A lot of people don't have that.
Let me
And
just
so
check.
if you, yeah, can you check? Are you good?
I don't have
So
much hair on
it's-
my chest. Tro has the hair on his chest.
Yeah, I
part, so
definitely got the hair part covered. Yeah.
I don't know.
That's why we're a good team.
Yeah.
Like Verta figured something out, right? Verta figured something out, but they're centered in diabetes.
Yeah.
There's got to be something that we can figure out. And even
Yeah,
if it's just like
I think it's
figuring
just
out how I work with you guys across state lines and we start there. I don't even know. Because like remote monitoring.
You know, Brian asked me, Tro, why are you going through this? Why are you going licensed in every state? Here you go, Jody. It's so we can meet one day. I'm licensed in over 40 states. There's a reason why. So every doctor doesn't have to go and move to, you know, we can just stay in our own place. And there's some mothership somewhere that's able to govern it all, right? There's somebody somewhere that's able, if a doctor or a pharmacist goes on leave or has maternity in a different state, somebody has to be there to catch it all, right? And
you guys, we got to do this. I feel like we got to figure this out because my patients, because a lot of people find me on social media, Instagram and Facebook, 90% of them want to fire their PCP. They're looking for a new PCP that is at 10% supportive of a low carb lifestyle and not trying to talk them out of it.
even better. Those patients are getting fired by their primary MD. They're getting fired because they say, yeah, you're not doing this certain med or you're not doing this injection and I'm not taking care of you anymore. And so those people are seeking us out with that. We're like, I'll take you with open arms. Come on in. So I think there's that. And I think that the whole team approach, I think there's a lot, you know, in my practice now I'm using Restore. So I'm a mini version of Tro. I have my own app where people can meet with me once a month instead of once a week. And we have health coaches that are trained. We're all on the same page. And I've met with all of them personally and talked to them. And so when you have something like that, where the patient has 5 minutes, 10 minutes a day, here's the workout, here's what they like, stay motivated. They need someone in their corner. And it's that constant. And plus those patients can join us for our Zoom meetings, just like they're one of my patients that I see all the time. And we all build a relationship and you build a community. And that's what Tro's going to do on a huge scale. And it'll be successful because that's what you need. You need accountability. You need monitoring, like, you know, the CGM. So many people tell me that's a huge, huge benefit to them. And it is to me too. I've learned stuff I didn't realize I was spiking my sugars doing, you know, a certain drink that's supposed to be a sparkling water, but they added sugar to it and I didn't know. Right. So sometimes you just learn and go, oh, okay, that's, so I think there's a lot of that. But, you know, and I wanted to share something with you. I actually, you know, because I'm old, it's been a long time since I said the Hippocratic Oath, but do you realize it says, I will use dietary regimens which will benefit my patients according to my greatest ability and judgment, and I will do no harm or injustice to them. That's part of our Hippocratic Oath that we take. And all these people say, why are you talking about diet? It's like, that's in my Hippocratic Oath. It's in my oath. And you're telling me not to talk about diet with my patients and don't talk about like other things that might help them, then it's maddening, like what's happening with medicine right now, because
it is maddening.
We've lost that part of it. That's in our oath that we took. And now, you know, I was thinking, hey, Gary Fetke, how come we didn't like use that? Say, hey, this is in my oath, and I'm telling people a better lifestyle for them.
Yeah.
I think what you've talked about here, Brian, is so critical, right? This is our scope, right? Literally sitting down with people and coming up with a vision for their whole health. I had a young kid this morning who came to me, has a lot of anxiety and you know, OCD, and on the spectrum for autism, and on 6 drugs, and not one person ever talked to him about exercise or diet. ever.
Yep.
You know, what a shame, right? It's like giving somebody a car and saying, you know what, you're not going to get AAA and I'm not going to give you a spare tire, right? Like you just got to go screw up and call the tow truck each time, right? That's literally the way I would equate it. And this is most of medicine. And the reality is it took me an hour just to understand a basic part of who is this person and what is his goals? What is he looking for? What does he want? Right?
Yeah.
You can't do that in 5 minutes.
You can't.
You know, and the problem is we're trying to scale, and Jody, you're talking about scaling. How can you scale empathy? How can you scale good medicine? I'm not sure that it's possible. It has to be good people working together.
Yeah, that's what it comes down to. Like, yeah, that's what it comes down to, and having a goal of having the doctor who understands keto, who's a cardiologist. Like for me, I would give a part of my anatomy to have a cardiologist in San Diego who says, I understand low carb keto and I'll support those patients. I had Brett Scher, but he's gone now, right? So, you know, really, I mean, having someone who you can say, hey, look, this guy
Where did Brett go? Where did he go?
He's with Diet Doctor, man. Diet Doctor. So he's not practicing here in San Diego anymore. So any cardiologist, as a matter of fact, one of my new patients is a retired cardiologist. Why did he retire? He started talking low carb and keto years ago, and he's a great guy who gets it. And his partners like basically forced him out of practice because they said, you're too much of a liability, right? And I'm like, come out of retirement, I can use you, because he understands the data like no one else. So I think there's good people like that, Philip Ovadia, who we've talked to, and you know, just so many good people that start understanding. But it's the worst thing for a patient on anything. If you're saying, hey, do this, and then they go to the cardiologist, says, no, that's going to kill you. And then the kidney doctor says, oh no, you got to do this. And then they're hearing different things everywhere. So having a team approach, that's what Verta has. They have a team approach where everyone's on the same page. They go, look, here's how we manage this, and here's what we do. And, you know, it doesn't have to be the doctor every time. And so, but there's a value of seeing your doctor too. I mean, there's value in all this. So it's figuring out, like, having someone like you who says, hey, I'll take over the reins and let me work with these people, and we'll meet once a month with them. And you could, you know, I'll meet with them every week, and you meet with them once every month or 2 months. Right. And so just figuring out that, how we all play our role, and some docs don't want to do the coaching, and you know, so you figure out, okay, get someone who can coach and invest in that patient and connect with them. See, my office manager, like Tro, she's trained and she knows all this stuff, and she's lost 60 pounds doing keto, so she gets it, and she can help them and go, here's what I did when I was plateaued, here's what I did, and have people that you could just call and say, hey, I'm struggling here, what should I do? Right.
Yeah.
And that's the biggest thing, like taking that call. You know, taking that call. Do you guys hear me?
Yeah.
Yeah. Okay. Yeah. So being able to be the people take the call, because right now, imagine you called AAA and AAA said, hey, lady, put more air in your tire than you let out. And why are you calling me? Right? Like that's the equivalent of what, or you know what? You just need more foam in your tire, right? Like you just need more foam in your tire. Add more foam. Take more insulin. Right? You just need more foam in your tire. Like, let's give you some, like, that is the state of medicine when it comes to lifestyle change. It's terrible.
And it's, you know, I think COVID has exacerbated these things. For instance, a good friend of mine, I referred him to a good cardiologist I know that I've worked with for years. And he goes, Brian, I called their office 10 times, literally 10 times. I wrote down every time I called, so you would know, because I don't want to exaggerate. 10 times I called, I haven't received a call back. Over 3 weeks, and he's trying to get a colonoscopy before he leaves on vacation. So I was like, man, that's unacceptable. And I hear that a lot, where people, for instance, talking about the compassion gap. One of my new patients, who's fantastic, great guy, very smart, his doctor said, hey, he got COVID, go home, take Tylenol. If you get blue, go to the ER. That was the advice he got. So he ends up getting a paralyzed vocal cord from COVID, and goes into the ear, and they're like, big deal. It's not like you're going to die from that. Like and he goes, but I'm a singer. I sing on the weekends with my band, and I can't sing with a paralyzed vocal cord. But no one cared about that. Like, where's the compassion going? Oh my gosh, let's do something. Let's see what we can do to help you. But that attitude in medicine is just, it's stunning to me. You know, videos you see where they go, we refuse to see you. We're not going to help you. We have an ear infection, but we're not giving you antibiotics. Like that. What is that? Like, we took an oath for that. This is craziness.
Right.
Sorry, Tro, I'm passionate today, man.
A lot of apathy, man. A lot of apathy and a lot of paternalism. And maybe I doubt the pharmacists have it as much as we do, but you know,
Oh, they do,
Jody,
man.
you could tell me.
Well, it's just pharmacists are itching to do something that matters other than counting pills by fives. Do you know what I'm saying? Because that is not rewarding by any means. And people that have been in retail pharmacy their entire career, I have so much respect for these guys because I don't know how to do it. It's so robotic and it's so repetitive, and you're getting abused by customers. You're getting verbally abused over the phone by the docs you got to call because you can't read their dang handwriting, or they prescribe something completely wrong. And by law, you have to call them. It's a no-win situation. And that's
then you
why
have DEA rules, and you have rules for this
oh,
and rules
there's
for that.
so
And
many
it's so many
laws,
criteria.
rules. It is. I mean, if one Vicodin is missing in your inventory, it's a giant deal. You know what I'm saying? And so I just really am I love what I do, you guys. I mean, I am like the stinking luckiest pharmacist on the planet because I get to do what I do every day and connect with patients and change lives. I'm just at a point where I'm trying to figure out, what do I need to do? How do I get more pharmacists trained and connected with docs like you guys and in practices, and figuring out the billing component and all of that, is the next step. In our team, in our care team, who do we need? Who do we need in that care team? Do we need a dietitian? I envision a brick and mortar giant keto clinic in Hawaii someday. That's a multidisciplinary medical practice based in keto. And I want pharmacists in there. I want internal medicine guys in there. I want cardiologists. I mean, every specialty, oncology, endocrinology. How come no endos in Hawaii are referring to me is my question. They all know about me because other patients go back and tell them. How come no endos are referring? That blows my mind.
I had that conversation with the cardiologist. He goes, they're not going to listen. They have a way of doing it. I personally know friends who are endos, and they're like, no, you just give the drug. Just give the drug. That's just the way it is. And you don't have critical thinking and saying, well, that's not how it always was. It's not how we managed diabetes historically, way back in the day. We need to get back to our roots a little bit more. And root cause, I think, we forget that. Because it's really about controlling the sugars and not controlling the disease. That is where we've dropped the ball, and people it's hard to reset. That's why Jason Fung made such a huge impact on everyone, on me for sure, because I started thinking about, I'm looking at the problem backwards sometimes. Like, people get upset with me when I say, look, this sugar spike, whether you want to call it spike, whatever you want to call it, but I know the physiology is I have to spike my insulin to get rid of that sugar. So I don't really care that the sugar spikes, because I'll spike my sugar if I go for a long run. It's not the sugar, it's the physiologic response of that, right? And where it came from. So if it's coming from your fat stores, who cares? If it's coming from cookies, then it matters, right?
Yeah.
So I think it's that where you just look at the problem backwards, and sometimes you have to step back and, like what I'm talking about, critical thinking, say, okay, I've been doing this for 15 years. It's not helping anyone. Maybe I need to change what I'm doing. Then you have, 11 people come off insulin in 6 months, and you say, oh, okay, this seems like a pretty good approach. It's working. A lot of things sound good in theory until you put it into practice. You go, okay, that drug didn't work. It's not working no matter what the study
I also
shows.
think this is so simple and so common sense that people will not allow themselves to wrap their heads around it. That's my observation. To me, this is so common sense, and it's not hard. And is that the obstacle? Does that become the mental block? It can't be that
It's so
easy.
obvious, you think it can't be that easy. Like, if there's a puzzle and it's so easy to fix, you go, that doesn't make sense. It can't be that easy. Like, you question yourself,
That's why.
right? Yeah, exactly. I think that's what happens, because my
In
patients
medicine,
come back
we
and they go,
love to overcomplicate everything, right?
yeah, we use big words. Like, if I go to the dentist, I'm like, what the heck are you talking about? Because everyone has their lingo that you talk about. I'm like, what does that mean?
Right.
Like, financial guys use all, I'm like, what is ROI? What is all? I don't understand what this is. So explain it to me in human terms, and I'll explain medicine to you in human terms, hopefully. And that's part of, we have to be translators too, right?
Yeah.
But I think once people experience, the thing is, when people have success, like for us, and I know for Tro, is people are going out and telling their neighbors and friends and mom and cousin because they're having success. They're evangelists when they have success. If they don't have success, we all go out of business and it doesn't work, right?
Right.
So we have to figure out how to have success, and then we're worth it. Then we're worth the money to come to.
Yeah. Totally.
Even Tro is worth the money, probably.
I'm worth double.
Double, probably. That's probably true, man.
I'm worth double. Listen, man, we have a whole team here, and growing.
And I think that, I think honestly, we have to put that way. And there's what I've been thrown knows me, and I'm like, look, let's not fight with the diabetes educators, the dietitians. We can't be at war. We have to say, look, here's what's working. Let's get on the same page. Let's redo what because when you see it's not working, people know. I mean, I have people that are diabetes educators. They do low carb, and they're like, oh my gosh, look at my CGM. What happened? Like having them say, eat a week like you and eat a week like this and see what happens. And then they say, oh my goodness, like they understand it innately. And then they say, I've been trained for 20 years doing this. What the heck do I do now? Like we all get that. I got that too, that, oh my gosh, we're going to have to change everything I'm doing. Right. Mm-hmm. So, but also I'll tell you the other big factor that is important. People like Joan Iflin doing addiction, understand the addiction part of it. Because if someone's truly addicted, it's going to be hard to reach them without really dealing with the addiction part of it, or the depression part of it, or the stress part. That's why MDs are important to say, okay, I think there's a lot more going on here than just, you enjoy food, right? And sometimes that's what we get to. And sometimes it's just that they enjoy food and they just got into a lazy habit, and we have to fix that and help them, So it's complicated. It's not easy as people say, well, just do, eat less and exercise more. It's not that easy, or else we'd all do it.
You have to peel back all these layers in everyone's onion, and it can take a long time depending on the patient. But yeah, I don't know. Well, we're blessed. It's just like
super blessed for sure. And I think it's that of saying, look, if I'm having success and I'm helping people and they're getting better, man, it's hard to burn out, even if you're working a lot, And so that's why I'm thinking, how do we work less? We bring in people who know what they're doing, and they can do that part of it. We can't do it all. It can't be Tro, and it can't be me, because there's too much need. So we have to be able to hand it off and let the ego go a little bit.
I think more than anything, though, it's working together. Right. I think that's going to be the hardest part. I think that's going to be the hardest part, right? Is working together, getting doctors who are so vehemently, the people like us, look at these three people right here on the call, vehemently independent, disruptors, right? And willing to go against the grain, right? If it doesn't make sense, right? Willing to go against the grain. Now, imagine putting those people together. That's the hardest part, right? That's the hardest part, is coming up with a structure that makes these types of people happy. Because you can get another automaton doctor, but they just won't fit. It just won't fit. So how do we get Jody to work with Brian, to work with Tro? I think that's the future for our profession, for what we are trying to accomplish.
And I think it's, like a good marriage is not 50-50, it's 100-100, right? Everyone puts in 100%, and you go, I'm going to do my best, and I'll sacrifice. I'll take extra calls at night. I'll do what I have to do, and I'll do my part, and you cover for each other. I think that's what we've lost in medicine, because it's really become like, okay, how do I get the best out of every deal, and how do I make the most money of anyone? And when you have that attitude, it's never going to work. It's never going to work. You got to be able to say, okay, I'll sacrifice a little bit. You sacrifice a little bit, just like any negotiation, you try to make it, and you go, okay, I'll take it. Tro knows I've taken a huge pay cut for the last year and a half or so, or 2 years almost. And you go, okay, it's worth it, because I see the future. When you see it and and you're effective, if I made it, for me, I had to make that decision. I said, look, is it about the money? And that's really what I had to ultimately come down to. But Tro, I'm telling you, I've been watching all these news shows are sponsored by Pfizer. That's probably where the big money is, man. We get those guys to sponsor us, and we can really make a lot of cash.
Yeah, I'm sure they're ready to call us up right now, right?
They're thrilled with us, I'm sure, right? Yeah. Hi guys. I'm sure you got some nice people there, but I'm just making a joke. Everyone, this is not medical advice.
Look, guys, it's such an honor to talk to all of you guys and work with all of you guys. Brian, it's been this last 3 years. It's going to be 3 years. Can you freaking believe that?
Yeah, it's crazy.
3 years, Jody. 3 years I've had to put up with this guy,
Yeah, but Tro,
he tells me, we talk about old episodes of MASH, and I can't take it anymore.
And I wrote part of the
Hippocratic Oath. So Jody, I got somebody new now, Brian. Jody's here.
Yeah, I know. That's old school, guys. That's why, Tro, you could take over the world. I just want my maybe a little California, a little Arizona, a little maybe Nevada, maybe Utah.
Oh, see what happened? See what happened? Now you got.
We'll see. I got 2 states.
Brian, one day I'm hoping you're like, Tro, I can't do this anymore. All this back end stuff is super annoying. Come help me out, man. That's what I'm. Let's make this happen. I'm waiting for that day.
Yeah, but I think a lot of people listening, I think a lot of the pharmacists are like, what am I doing here? I'm burned out. What Jody's talking about, I see it. I've talked to several. As a matter of fact, it's crazy. One of my patients, he came in, he goes, oh my gosh, because he just came back to me from my old practice. He joined me. And anyways, this guy who was doing his medicines online for the health insurance is like, how come you're coming off all these meds? He goes, oh, I'm with Dr. Lenz because we stopped these three. He's like, from LowCarbMD? And he goes, you're kidding me. And he goes, oh my gosh, he's your doctor? Oh my gosh. And so I got to call him. He's in Arizona, one of the nicest guys. And he's burned out. He's like, how do I do this? How do I get out of what I'm doing? I want to help people and I want to be effective. And, when he gives advice to the patient, the doctors call and yell at him because he's saying, look, cut back on your sugar a little bit. You can not need as much insulin. And then people get upset with him for helping the patient. It's crazy. It's a crazy world we're in.
Well, I mean, I think, right, when we figure out how we're going to combine forces, which, we'll see, right? If there's some way we can, and like the fact that all of the insurance payers here in Hawaii, they all know about me. Blue Cross Blue Shield Hawaii is in absolute support of my low carb keto clinic. I mean, they sat there and helped me figure out how to do this legally. I've got guys that are like, this is how we can track all of your metrics, because we stand to save payers millions upon millions of dollars every year in healthcare costs just by teaching people how to eat low carb and helping them with their eating behaviors and food addictions. I mean, economically, this is such a massive no-brainer. To me, it's almost a joke. How come every payer on the planet is not trying to bust down our doors to come talk to us, right? And so, it's just, there's so much that I do here in Hawaii other than see, you know what, you guys, I only see patients Mondays, Wednesdays, and Fridays, because Tuesdays and Thursdays, I'm meeting with restaurants, I'm creating keto menus, I'm meeting with payers, there's all, I'm working on the government affairs committee for the Hawaii Pharmacists Association. We're trying to change the laws around our providers. There's all these things that are part of this entire movement that I think people don't realize to make it believable, credible, sustainable. Sustainability is key, right? But it takes all of that. And I'm like, dude, I'm just one person, so I can't do everything forever.
You know what? This is exactly, who came to us before the payers? The payers are now calling us because of the amount of out-of-network bills we send them. But now they want to know what we're doing, right? You know who came to us? I have had two major corporations, huge corporations, come to us. We saw what you published, right? Come do it come save us money, right? That's the people, like, they come to me and they say, it's a win-win-win. We pay you, you save us, the patients
employer
get off meds,
groups.
They get off meds and the patients are happy, they're losing weight. It's a win-win-win.
Yeah, and that's one thing we're looking at too, Troy, is the employer group say, look, we can come, like we did it in Vacaville Fruit Company, shout out to you guys, but because they cared about their employees, and we went up and we made a difference, and we did a lot of Zoom stuff, and we changed, and we had fun, and we, like you said, it doesn't have to suck, you can laugh and have fun and go, oh, look what I did, look what I didn't have, look what happened when I ate this, and then we had fun, we had a blast. So I think it's one of those things we could do it in a group setting. That's the other huge thing, is that for employers, like, look, you have 50 employees, we can meet with you all at one time. It's 1 hour of my time, and I could educate everyone at once, or I could sit there with each employee for an hour and spend 50 hours, or I could spend one, and then we can have a discussion one-on-one for half an hour afterwards, right, with each person. So there's things like that we could do there. It's telemedicine is now, it's critical, right? Because our group meetings, Tro has been doing them also, the Zoom meetings where people can ask questions. They go, oh my gosh, every time we do it, people come and go, oh, what Sally said really helped me. Wow, I really got that. That really, like, Brian, you weren't getting it, but she got it, right? So, okay, cool, right? Whoever can help you, whatever works for you. And I've learned a ton. And we learn from our patients. We have to listen and learn. We're good at talking. I'm good at the Tro will say that. Yeah, Brian's good at talking, so is Tro. But, it's really important that we all kind of say, okay, how do we make it happen? How do we have the pharmacists involved? How do we get people on our side? So, and I know some great pharmacists. There's some great people out there, very smart, and they're just getting beaten down. It's sad.
Yeah, we're underutilized, and we're utilized a lot in the wrong way. And there's so much more value that we could be bringing. And I'm trying to bring light to that for a lot of people, you know.
Who better than to de-prescribe, you know? Who better, right?
Yeah.
Who knows the meds better? Like, hey, this pear is not great. Like, let's get you off
Like
this one, right?
we're the weirdos that actually read a package insert. Do you know what I'm saying? Like, we love that
No,
stuff.
I'm not weirdo too, but yes. So we are the readers. Jody, I can't believe you didn't call me yet. You know, this is now I'm getting a little. We got a podcast, and Jody, I feel like we're kindred spirits, 3,000 miles apart. You know,
yeah, we tried to get, because of our time differences, it was hard to set it up, because the first one, Troy, you set up for like Jody had to get up at 2 a.m. or something. It was like 3 a.m. I'm like, seriously, dude, really? Jody's dedicated, but not that much. You got to get some sleep, man.
This is awesome.
Nah,
guys.
it started with Brian. I mean, I tackled him in the hallway several times in San Diego because we had tried to connect before, and I'm at this point in my clinical practice where I'm like, man, I gotta have some colleagues out there that I can talk to about stuff, because I can't talk to anyone in Hawaii about it. You know, I'm on an island in the middle of the Pacific Ocean. I'm like all alone out there, you know? So
Brian gets all the nice people, you know? Brian always gets the nice people. Well, I don't know what it is.
No, it's hard. I think, honestly, that's how I felt. I was on an island too when I first started doing this. I'm like, no one, keto back then, Tro, when we first, no one knew what that was, or low carb. They're like, what the heck is that? What is that?
Yeah.
Like, and so now, like, you heard people talking, when I would hear people out talking about keto, I'd be like, what? They're talking about keto. And then there's saying crazy stuff that's not true. But, I think it's one of those things where over time, people start understanding. Now, I think COVID has brought this to the forefront. There is no doubt about the effects of metabolic health. The data is very clear on all these metabolic diseases, low vitamin D, deficiencies, and, stress, affecting the not exercising, all these things that affect the immune system that no one's talking about. So now all of a sudden we have credibility. Why? Because our patients are going to do better. Look at Verta's data. Like when someone just posted something saying diet doesn't make any difference in COVID. Oh, look at Verta's data and get back to me. Right? They have data on this, and they've shown decreased mortality, decreased ventilators, decreased death rate. So it does make a difference, right? So we just have to figure out how to bring it to more people.
Yeah.
Mm-hmm.
I can't wait. I can't wait to work with both of you guys.
We'll figure it out. We'll figure it out.
This was great. Thank you, Jody, so much for coming on. Actually, let's open it up. Do we
you have a couple questions. Anyone else have questions? Throw them out there.
Okay, let's see. We got one. Okay, no, there's just like an anonymous thing. Low carb pharmacist deep down the rabbit hole, working at the VA in Arizona, getting plenty of resistance from multiple disciplines.
Mm-hmm.
I know who this person is.
Okay, how do you think pharmacists like Jody and myself would be welcomed by other low carb physicians, given the general reputation of pharmacists as medication focused and barriers to reimbursement? Can I start with this one, Corey? This is Corey's question.
Yeah, Corey, we need to get you on the podcast too, by the way, man.
Hi, Corey.
Yes.
Yeah, so let's, you know what? Should we bring him up? Let's just promote him and get him up.
Yeah, promote him, but we want to hold one with him too.
Let's see. Okay, we'll
He's a stud, man.
All right, Mr. Jenks. Let's see. Maybe he doesn't want to be seen or heard, but we'll see. Corey, are you on? Let's see. Let's see if Corey's on. No, maybe he's not. Anyway, I'll tackle.
Yeah, he's coming. He's coming.
I am. I'm in a hotel right now. I'm traveling. So
hey, man.
Hi, Corey.
Good to see everybody.
Okay, so ask the question. Go ahead. Ask the question, and who do you want to answer it?
I'm licensed in Arizona, by the way, man.
You are? Okay, cool. So this is for the physicians. So you all, I think, Jody, I love how you hit on, and you have all hit on the importance of that team-based approach. And inherently being low carb, you're more open-minded to different ideas and different approaches. Having a pharmacist come in and join a physician's practice is like not a normal thing. And so, however, you mentioned the business barriers, the reputation barriers as us as pill counters and medication focus. So how do you both seem very open to the idea, but how?
I'll tell you right now. We've thought about it, Corey. I'm going to tell you right now. One, we would like a dark pharmacy, right? Like if you look at it from a business perspective, right? Yeah. I'd like to, one, be able to verify lots of medications, know that what I'm sending to my patients is exactly what I'm ordering, know that everything is of the highest quality, right? When we do order medications. 2, I want somebody reviewing medications, med reconciliation, figuring out an ideal strategy to deprescribe and how to safely deprescribe, right? So if you think about it from like a healthcare outcomes perspective, the marriage is very easy. From a business perspective, the marriage is very easy. If medications are ever needed, to know that we can actually, being able to send people in the mail, just like we send a scale in the mail, just like we send a blood pressure cuff in the mail, to be able to send them a way to dispense, like give them pill packs that we know work, right? And make it easy for them to take medications if they need them, that to actually taper the medications already, like kind of, so they're not sitting there counting pills, right? I think this is an ideal marriage and has a lot of business and health outcome implications. But again, if you look at it, like we have 4 whippersnappers here, how are we going to all work together? Good things are possible, but it's hard. Imagine working with me, imagine working with me. Jody already has a headache. She's like, oh, what did I get into?
I think from a financial model too, I think what helps is if you are billing insurance, right? And then if the MD brings, which is not my model, but you can bill for the pharmacist's time, incident 2, and then you just pay the pharmacist a salary. So like in my scale up model, that's what we're looking at, because I have a handful of pharmacists in Hawaii that are like, pick me, I want to come work with you. But it's like, okay, how do we pay them? Do you know what I'm saying?
Yeah.
And so
I think that, and I think even like for those of us who are outside the insurance model, like myself, I could say, look, I'm charging so much a month for the medical weight loss, and if I have to meet with that patient every week, that's my time, right? So if I meet with them once a month or every 2 months to order labs and do those things, and Corey, you go, hey, I'm going to manage this, I'm going to taper the meds, we'll work together. Brian, I'll let you know when we're tapering stuff. That is the safest way to taper medicines. And if they need a med, like I could say, hey, here you go, send a script. The patient could be here and we could give them their med right there. They don't have to wait. And so like Tro's saying, it's patient service. Plus we could do it a lot cheaper and better. And the patient doesn't have to go sit in the pharmacy for an hour and wait for their med to be pulled, right? Or say, hey, did they get the email? Like all the time we send it electronically and they never look at the order and the patient's sitting there. And they go, oh, we didn't look at the computer. It's been here for 2 hours, right? Stuff like that, like just saving people hassles is really nice.
I think
and that's the model that I practice in, is an independent, diabetes, hypertension management, where I'm writing my own prescriptions. So that's the federal system's nice, but yeah, being able to transfer that over to the private sector. And I again, this is a unique group of people that are just open-minded, looking to make the changes. So you all are all on board. It's getting outside the 4 of us and everyone listening to buy in as well too, to make that model successful.
Corey, can I tell you one other thing? We would love a dark pharmacy, because as a physician, I'm not able to dispense more than a short-term course in multiple states. So for example, Texas, Massachusetts, New York have very strict laws that physicians are only allowed to dispense about 3, like a short-term supply of medication. So even when people come to me for things like CGMs, I'm legally not allowed to send them more than 1. Right? Even though this is something they need for, and we send them, so we'll send them 1, it's a short-term supply. We respect the laws of New York and Texas and these other states that have very strict laws. But ideally, from a business perspective, we would have a dark pharmacy. I call it a dark, like a hidden pharmacy that just works in concert with us, right? To make this easy for people, get them what they need, get them it in an easy way. They don't have to go to the pharmacy for one thing, go to the doctor for one thing, go to their health coach for another thing, go to their dietitian for another thing. It's all like one care, right? One care, one plate, one number, text one number to get what you need, right? Yeah, so I think...
Yeah, and if we could dispense the CGM right in our office, continuous glucose monitor, we could do all that stuff.
Oh, that'd be a dream.
Yeah, that kind of stuff. Hey, we'll put it on you.
Hey, whoa, dream.
You do, but I don't. Doing it. Because they'll go and they'll pick it up and they come back and I put it on them and then we talk and then, so it's fun.
We went through the pain of doing it, Yeah. Oh, the pain of doing it. Let me tell you.
Yeah, it's pain.
Sorry. All right, sorry. Corey, anything else?
No, thanks for giving me on. I gotta stay muted here. It's a busy lobby, so it's a pleasure. And
yeah, man. Hey, thanks for joining us, man.
Yeah, thank you. This is awesome.
Safe travels.
Yep.
All right. Did we have any other questions? I think that was it. You know, I think that was it. All right, Jody, thank you so much for coming on.
Yeah,
Brian,
thanks
always
so
a
much.
pleasure.
Thank you,
This has been
guys.
absolutely great.
Aloha.
All right.
Shaka,
We'll come
aloha.
visit you there. We'll come visit you there. I got family out there, so I gotta
Yeah,
get
when you
back.
have
Yeah,
a conference,
I don't think
come
they'll let me on the
by,
island quite yet, but
come get me and Brian
try.
out there. You know, my wife, you know, I promised her a 10-year anniversary. 10-year anniversary came. I was like, it's COVID. Maybe we gotta, you know,
No,
delay
Tro,
it.
talk to Doug. We were going to have Low Carb USA in Hawaii last year, but we canceled it because of COVID.
Okay, so you'll let me know.
Yeah, so we got to make that happen. I
So
think,
let me
like,
choose between New
Australia
York
folks
and
would love to.
Hawaii. Let me see here. Where would I rather go for vacation? Let me
Right?
think about it.
Right?
All right, guys, I have to head out. Jody, it's been awesome.
Thank
Brian,
you.
All right, everyone. Hey, good
it's
seeing
been
you.
awesome.
Jody, thanks
Thanks
for
so
joining
much.
us early. Have a good one.
Thank you.
All right,
Bye-bye.
thank you. Bye.